There is a common misconception that in order to use the thoracic diaphragm efficiently, the rib cage should remain fairly still as the abdominal wall around the navel expands, resulting in belly breathing. This was taught in my yoga teacher training and is still commonly taught by both rehab providers and movement teachers. The most common reason given is that this is how a baby breathes. The ribs of the human fetus are comprised of cartilage as well as areas of bony development called ossification centers, as shown in this beautiful illustration by medical illustrator Stephen G. Gilbert. At birth, only 30% of the spine has ossified. The pliable, largely cartilaginous rib cage allows for distortion as the fetus passes through the birth canal. Babies are born with a few major differences that change during ontogeny or the growth process. Newborns have a horizontal rib cage with the ribs meeting the vertebra at almost 90-degree angles. The rib cage diameter is nearly equal front to back and side to side in the newborn compared to the elliptical shape or oval-shaped rib cage in the adult. Newborns have a horizontal or flattened thoracic diaphragm. The diaphragm is domed in the adult, sits higher in the thorax, and works more efficiently. This X-ray shows the diaphragm and rib cage of a 2-year-old with the long arrows pointing at the right diaphragm. You can see that the diaphragm is more dome-shaped compared to the previous images of the newborn. This X-ray shows an adult rib cage and diaphragm. The middle arrow is pointing at the diaphragm that has its characteristic dome shape. The bottom arrow is pointing at the 12th rib, which is obliquely angled compared to the horizontal ribs of the newborn. The abdominal visceral contents of newborns are proportionately more substantial than in the adult, restricting the inferior movement of the thoracic diaphragm. The abdomen is broader than it is long. In adults, it is longer than it is broad. Newborns have low abdominal tone. In the adult, abdominal tone counteracts the intra-abdominal pressure change that occurs with the descent of the diaphragm. Abdominal tone increases the work of the thoracic diaphragm. In adults, the thoracic diaphragm is a major muscle of breathing, doing 80% of the work. In newborns, the diaphragm is not as strong and they are forced to belly breathe using shallower and faster breaths. The nervous system continues developing after birth, and by the age of 2, the child has 58% type 1, or slow twitch, fatigue-resistant muscle fibers in the thoracic diaphragm. By the age of 10, the ribs are angled obliquely, and the rib cage has the ability to expand in an anterior-posterior direction. The ribs and sternum continue to ossify, although not completely until 25 years of age. In the adult, the thoracic diaphragm is obliquely angled and the abdominal wall has developed tone. All of these changes result in the inferior movement of the thoracic diaphragm during inhalation, accompanied by a 3-dimensional expansion of the rib cage and thorax, rather than the belly expansion present during an inhale in the newborn. To experience breathing as a baby would breathe in the first 6 months of life, we're going to lift the breastbone up, we're going to hold it there, we're going to try and widen the rib cage sideways and hold, and then breathe. So if you keep those actions of the breastbone up and the ribs sideways, you're going to feel that you have to expand around your navel. And I'm going to turn sideways and do that. So I'm going to lift breastbone up.
Can you move your one arm, Ricky? Okay.
I'm going to widen through my side ribs. And as I breathe, it's going to be more of a belly breath. Don't have a choice, really.